This is Dr. Ko. I want to take a few moments to talk about my treatment philosophy in my office, and after 20 something years of practice, my view of how I like to treat teeth these days. This video is made 2024, so things of course could change as things improve and new research comes, but this is my philosophy for 2024. So let's look at this patient. This particular patient came to me because he gets jaw pain and headaches, and daily headaches. One thing we can tell is how much overlap there is between the upper and lower teeth. Right, so if you go back and forth, these are what we called 90% overbite. So the top teeth basically covers all the bottom teeth 90%. Now, if I tell you that in this position, the lower jaw is severely trapped back, if you can imagine that, right? So if I have a magic wand and I can squeeze all these teeth and just push it back a few millimeters, the lower jaw has no place to go but back. Right? So if I put my thumb on these two front teeth and just push it back, angle the teeth back a few more millimeters, there's no other way for this jaw to break free other than going back, because that's how the teeth work. The top and bottom teeth are like partners, right? So if the top teeth are angled this way, the lower jaw cannot break free. This is associated with the symptoms that people have a lot of times, right? So typically when we see deep bite like this, these are what we call vertical overgrowth or lack of horizontal development. So vertically, the teeth are going down, trapping the lower jaw in. So a few things could happen when this happens. One is because the jaw doesn't want to be there, the muscle has to fight against teeth. And these patients typically have headaches. They have postural issues. A lot of times TMJ issues, cracking, pain. And then they have wear issues. So you can see the wear. I think this particular patient wants to break out, but you can see the wear mark on the teeth. Now, this is hard for him to break out because he's so trapped, right? So our treatment for him basically is to create more room so that there's a little bit more freedom. So that's patient number one. This is kind of an extreme example. This is extreme vertical overgrowth that traps the mandible, traps the lower jaw in. I'm going to show you a different patient. Similar story, but a little bit different. Again, 80-90% overlap. Trapped also. And the difference between this person and the previous person is this person's muscle is stronger. So it would destroy anything that's in the path. Okay? So you can see the chips and wear and the crowding. So really similar story, just different presentation. Not enough horizontal growth. So imagine if I can put my thumb inside and press all these teeth from inside out to create more space for the lower jaw. Then there's more freedom. The lower jaw wouldn't be trapped. The teeth wouldn't be this worn. This is what he likes to do. Right? That's how the teeth fit together. Notice that nothing touches in the back, but the teeth fit like a jigsaw puzzle in the front. So positionally, his mandible likes to be here. That's why there's significant wear in the front, open at the back. When he goes in this position, can he function? Yes. He has to function like this when you choose. But he is rather positioning himself in this position. All right, so the goal of the treatment basically is to get these teeth out of the way so these don't touch anymore and the back teeth will touch. Like I said, putting a thumb on the inside, push it all the way out to create more space. Same idea, creating more space so that there's less force on these teeth. So I opposed to some dentists would happily take a drill to all the teeth here, every single one, and crown them. This is not the way I like to do things. So a lot of times we would use Invisalign as our tool prior to even taking a drill to the teeth. This particular patient, that's what we did. We ended up doing way less dentistry because we're able to actually move teeth around to create more space and have less destruction. Then we come to somebody in the middle. Okay, so decent shape and size of the teeth, but you can see wear. So the first two examples are severe. Third example is not as severe, but there's definitely signs of wear. These are all signs of wear. Okay. Now this photo was taken about 10 years ago. I can tell you that this is way worse these days. Okay, so signs of wear. Now, whenever you see crowding like this, and mind you, if you look at this, canine, we should have enough space to fit all these teeth in. Not only we don't have space, but these teeth are angled in to accommodate the top teeth. So, as the previous example, where is he going to destroy? He's going to destroy the front teeth because his jaw does not want to be in this position. The only way he can actually break out of this position is move his jaw forward, and in the path of doing that, teeth wear down. So the treatment goal is really the same. If I can take my thumb here and push this all the way out to create more space, he's going to be less likely to destroy these teeth in front. So hopefully that's helpful. That basically summarizes a lot of the treatment philosophy we have when it comes to jaw, headaches, occlusion, and even prosthetic aesthetic dentistry. So hopefully this is helpful. If you have any questions, please do reach out. I'll be happy to talk to you about how we can help you. Thank you so much.